Luna, the patient's crashing. What's your first step?
Start the bradycardia algorithm. Give atropine.
Maybe, but what is this ECG trying to tell you? Luna, what diagnosis ties these ECG changes together?
Hyperkalemia!
Exactly. This is the classic ECG progression. Recognize these changes before arrest.
Conduction slows as potassium rises. I thought high potassium would make the heart more active.
Too much potassium slows electrical conduction.
Doctor, what's the first medication?
Lower the potassium?
First, stabilize the heart.
Doctor, atropine treats bradycardia. Why didn't it work?
Atropine treats excess vagal tone, but hyperkalemia slows conduction. Treat the potassium first. Luna, we've stabilized the heart. What's our next step?
Shift potassium into the cells.
Excellent. These treatments buy us time. Have we removed any potassium from the body?
No, we only moved it into the cells.
Now we have to remove it. Luna, now that the patient is stable, what do you notice?
He has muscle weakness.
Exactly. Hyperkalemia affects skeletal muscle as well as the heart.
The potassium is high.
Before treating, ask one question. Is the hyperkalemia real?
Wow.
The potassium increased in the blood tube, not in the patient. That's pseudo-hyperkalemia. Luna, we've treated the emergency. Now, what caused the hyperkalemia? Raching, treat the Luna, what's the kidney's job?
To remove excess potassium.
When the kidneys fail, potassium stays in the body. Luna, what are the most common causes of decreased potassium excretion?
The kidneys can't eliminate potassium, so it builds up in the bloodstream.
Luna, why do AChy and CKD cause hyperkalemia?
With fewer functioning nephrons, the kidneys can't secrete enough potassium into the urine, so it accumulates in the bloodstream.
Luna, what happens when the body doesn't produce enough aldosterone?
The kidneys can't excrete potassium efficiently, so potassium accumulates in the bloodstream.
What if the kidneys look normal?
These drugs can keep the kidneys from excreting potassium.
Exactly. Always review the medication list. How do these medications cause hyperkalemia?
They reduce or block aldosterone's action, preventing the kidneys from excreting potassium.
Luna, true hyperkalemia usually results from potassium shifting out of cells or the kidneys failing to excrete it. Increased intake alone is rarely the cause.
So now we identify the mechanism.
Luna, can potassium be high even if total body potassium is normal?
The potassium didn't increase, it just moved out of the cells.
Exactly, it's redistribution. Luna, what conditions cause potassium to shift from inside the cells into the bloodstream?
These conditions don't increase total body potassium, they redistribute it from the cells into the bloodstream.
Luna, why does insulin deficiency cause hyperkalemia?
Without insulin, the pump becomes less active, so potassium cannot move into the cells and accumulates in the bloodstream.
Luna, how does hyperosmolarity cause hyperkalemia?
High glucose draws water out of cells, and potassium follows with the water into the bloodstream.
Where did all that potassium come from?
From inside damaged cells.
Cell injury releases potassium into the bloodstream. Why does rhabdomyolysis cause hyperkalemia?
When muscle cells rupture, they release their intracellular potassium directly into the bloodstream.
Why does tumor lysis syndrome cause hyperkalemia?
When large numbers of cancer cells rupture, they release their intracellular potassium directly into the bloodstream.
Luna, what caused this patient's hyperkalemia?
Doctor, another patient has a potassium of 2.4.
Low potassium?
Low potassium, that's tomorrow's mystery.